Good morning, ladies and gentlemen. It's a great pleasure for me to welcome you to our first joint Personalized Health Day. And on behalf of the ETH domain, it's a pleasure to show you some insights into the program, which is complementary to what Peter just mentioned. The genome revolution and the Human Genome Project has shown us that each person is genetically different. That was a breakthrough, and it has given us at least a lot of options to tackle new problems in terms of diseases. However, very quickly we've been surprised that these combinations, which are identifiable between individuals with 99.9%, show not so much differences to a chimpanzee. Well, books and books can be written, and as you all know, there might be some error in this type of translation. So that means the expectation just from the genome to tackle this problem is maybe not sufficient for our future. And therefore, it is the good starting point, genomics, but we know, and as Peter showed already, there are so much more molecular interaction networks, process function, which we have to unravel, and these are very complex and related to clinical data and also to related technology data, the entire omics, which need to be unraveled from the beginning, from the genome, over to the physiology and the medical diseases. This is actually what we are working on. The starting point, as you see it here, are the genomic data. But what we would really like to do is actually to determine the phenotypes, because this will give us the differences in disease, but also the difference in healthy person to distinguish between both of them. And therefore, we have a lot of questions which we would like to answer. We cannot at the moment, and it's shown here, mutations on phenotypes, more mutations, independent, how they combine, and you can ask and address more and more questions on it. How can we solve these? And that's the reason why the ETH domain decided to join this project. We can only solve this by implementing all the new research technologies, not to make it even more expensive, but to figure out what data are necessary actually to really unravel these questions related to the diseases. So therefore, the ETH domain actually set up this complementary program, and we are well aligned with the SPHN initiative because we share the need for data, and therefore the interoperability of these data is a prerequisite. And that needs to be connected to the hospitals, and the research will go on in the laboratories really to complement our way to the phenotypes. Therefore, 50 million have been taken in the hand, and we are very grateful to the ETH domain, spread over all institutions, and it's not an ETH project, it is an ETH domain project, which includes all the 6 institutions. And I'm representing here the 2 key players at the moment, Didier Trono from the EPFL and Rudi Ebershold from ETH, who are coordinating this on an operative side. The idea is that we are splitting this in 4 different pillars. Education and fellowships is very important because we need educated students into the future who actually carry on this initiative. We need platforms to generate, as Peter said, precise and accurate data, which we can put in a format where we can read out something, and then technology translation projects, which are very important, and personalized health or personalized medicine, really research projects to develop new technology, and we have a lot of new technology in imaging, but also in the omics. This has a very close link to the Swiss Data Science Center, which the ETH domain set up at the same time. There, the leading house is the EPFL, and we are working jointly together. And you see that in most cases, in the infrastructure development projects, we have a very close link because we need the link to the hospitals to get access to some of the data and also to some of the fundamental questions related to certain diseases. The splitting has been set up. We have had the first round of projects, very successful, and we're very pleased that so many of you who are involved in this initiative are present today. Now, the idea is, on paper it looks very brilliant, but the reality, we have to open a lot of doors really to get each other aligned to have the same common goal. And that's the reason why we hope with this initiative and with this joint initiative that we foster the team spirit between hospitals and research institutions, that we are not thinking in the direction of one paper. We want to bring us closer to the society in terms of using the data useful for the benefit of our patients. So that means we have to work on all the topics you can read yourself, but most important, and that's what I hope from today, we also want to link us to the society and want to open the doors to explain what we are doing in this initiative. With that, I wish you a very pleasant day today, a lot of interaction, and if you leave the room tonight and say, I learned something, well, then we have fulfilled our mission. Thanks very much.